Hi, do you have room 22?
Yes, I do. Are you the nurse taking over?
Yes, my name is Christina.
Oh, funny. Mine is... What are you doing here?
What do you mean, what am I doing here? I work here.
No, I work here.
I just got hired.
Oh, great. Okay, let's do this. So, are you ready for a report?
Yes, ma'am.
Okay, so a 56-year-old male, full code, admitted 2 nights ago, was having shortness of breath.
Wait, so how old is he? Actually, let me go look for a paper and pen. I'll be right back.
Okay. Today, I'm going to show you how I take report that will also include all the do's and don'ts. My name is Christina, nurse practitioner. Let's get started. So this is how I take report. So every nurse has their own style, and with experience you develop it and you're able to create this template for you. However, based on the unit that you work on, they're looking for certain things within the report. As a resource nurse, I float to several departments. I could be in the ICU, I could be in telemetry, PACU, OB, so it varies from shift to shift. However, I'm going to show you information that is significant and that will relate for anyone on the unit. Okay, so let's get started. So here is, I'm going to write the patient's name here. I'm going to include the room number. I'm also going to include allergies, which is very important. I'm going to include the patient's code status. Okay, I'm also going to include when the patient was admitted. I also need to include if there is a type-in screen. So if on the floor, if they're giving a lot of blood products, you want that to be included as well. So you want to know when the clot expired. You also want to know the dosing weight, especially if you're going to be giving a lot of drugs like dopamine or drips. You also want to include the team. So is it surgery on team? Which services? Is there cardiac? Is there endocrine? If so, you want to include that. If there's a respiratory therapist, you also want to find out, at the end, you could write their numbers here. I don't expect the bedside nurse to be able to give me this information, but I definitely, to make my shift a lot easier, I will write those numbers down. So that way, if I need to get a hold of a doctor or provider, I have a number that's available. So then that way I know how to contact them quickly. In addition to that, I'm also going to include history, the most significant stuff that's relevant for the patient's care. So I also include the story. So the nurse is going to tell you the story, the reason why they're there, and their diagnosis as well. They're also going to include if there was any surgeries or any type of significant events, okay? Or maybe they coded, you definitely want to know that, anything significant. So for neuro status, you want to include if they're alert and oriented ×4, or if they're not, what their GCS score is, what their strengths are. If they're 4 on all limbs, if they're 1, you want to know their strength status. You also want to know their range of motion, if they're moving. If they are on seizure precautions, you definitely want to know when the last seizure was. You also want to know if they have a ventriculostomy drain. You want to include the settings as well, or if they are on seizure precautions, you want to know and they have an EEG monitor, you want to know the settings and what it's doing as well. And for neurostatus, I also like to include on this section pain. So I like to know if there's any type of like pain medication, like they're taking oxycodone, or if they're taking Dilaudid, and the frequency and such, and if it's being tolerable and if they're able to tolerate it. I'll also include here their activities. So are they, you know, one person assist, two person assist, if they're able to ambulate, do they need a walker? Are they having any type of pending physical therapy or occupational therapy, or, you know, if they need speech services as well, I'll include it in this section here. So moving on to cardiac. So I want to know the parameters. So what's the blood pressure like? Are they, you know, consistent with their trends? Sometimes some of the nurses will also include if they're on like metoprolol or they had a dose increase. You could also note it here as well. You could also you want to include the rhythm, if they have a pacer, what is it, you know, what are the settings, if they have any chest tubes, if it's to suction or to water seal, I'll include it here. And then maybe they had some potassium repleted, so that's an electrolyte. You definitely want to know if they have any ectopy or if it needs to be checked. Sometimes the nurses will also include here, like if they had any Lasix, if they have any type of edema, and what their pulses are like as well. Moving on to respiratory. So with respiratory, you want to know, what do their lungs sound like? Is it bronchi? Is there wheezing? Which I just delivered a few videos on those sounds, which you're able to listen to if you'd like to take a listen to that. And then I also want to know if they're on any type of oxygen. So are they on nasal cannula? Do they need a BiPAP at nighttime? What are those settings? If they have a vent, what are the settings? Is it assist control? What's the FiO2? Where is the tube at? Is it 22 at the teeth? Has it been repositioned? These are all things that I need to know that is very relevant to the care. How often do they need suctioning? You know, is it just oral suctioning, or is it, you know, do they need to do any type of NG suctioning as well? And then oral care is also important, because especially if they're on a vent. So moving on to your gastrointestinal. So with gastrointestinal, I'll include their food status, such as, are they NPO? Why are they NPO? For how long will they be NPO? Is there a plan for that? I will also include if they are on maybe a regular diet. What's the type of diet? Is it, you know, a clear liquid diet? Is it a regular diet? Is it a puree diet? Do they need thickener for precautions because they're on aspiration precautions as well? So you need to know those things. Are they having any nausea, vomiting? Is it being controlled? So those are things you want to sort out through, especially when was the last bowel movement. The doctors and team are big on that. And so maybe they need, you know, a bowel regimen prep. You want to make sure that when you do assess them, like, is there, you know, normal peristalsis in the tummy, and how are they doing? Do they have an NG tube? Is it an OG tube, or is it in the nair? What side? What type of suctioning? What type of secretions are coming out? Is it greenish? Is it clear? What is the consistency? These are all things that are very important. So moving on to your GU, I'll include if they are, you know, if they have a Foley, or if they are voiding, and what's the frequency. If they do have a Foley, maybe it's like 40 to 50 cc's per hour, or maybe, you know, the Foley just got removed and they are due to void, you know, within the next 3 hours. So I'll make a little check mark there for me. And if the nurse hasn't covered this information, I'll kind of highlight it, or I'll make a little star asterisk next to it if I feel that she needs to elaborate more on it. But I definitely don't ever want to interrupt the nurse when she's giving a report, because she has her flow and her style, and I kind of just wait until the end to ask these questions. So moving on to endocrine. So I like to include endocrine here. And then a lot of patients, you know, if they have diabetes or they're on, you know, strict blood sugar control, you want to include if they are on insulin coverage, what algorithm. So sometimes they're in algorithm number 1 or number 2, number 3, it just depends. And then if it's significant, you could also include the trends. Maybe they've been within normal, maybe they haven't been within normal, and then maybe they just got added some Lantus, or you need to check in with the team, or you know, they need to change their diet to a carb controlled diet as well, or you need to do some education. That's very important as well. For skin, this is where I like to include, you know, if the patient has any wounds, what that care is, and we'll look at the order set and review that. You also want to make sure that if they have any type of drains, so drains, do they have, you know, like a JP drain? Is it to bulb section? You know, any type of things like that. Or if they have any type of ostomy sites, is it nice and beefy red, the stoma? Those are all very critical things. Or if they have a pending wound consult, or maybe they just have like a Mepilex on a bony prominence, such as their bottom, and you want to make sure that's replaced, and that the skin is intact, and you physically want to see the patient's skin as well on handoff. In addition to that, you want to include your IVs. So what I do is, let's say the patient has a PICC line, and it's a, you know, right upper extremity. So I put RUE for PICC line, and then what I do is I make a little asterisk out here, and they'll say, oh yeah, you know, there's TPN, total parenteral nutrition, infusing in one line. So this is my one line. Typically a PICC line is double lumen. And then my second port, you know, there's maintenance fluid. It's D5, let's say half an S at a rate of 75. Okay, so I'll have that. And then maybe they have a 20 gauge peripheral IV on their left AC. And, you know, I'll include whatever's infusing in there. Maybe it's, you know, insulin because they're getting insulin checks. And then, so I list all of my IVs here, and you know, there are some nurses that will tell you, oh, you know, this dressing, the PICC line has been changed 2 days ago, or it's due to be changed, but typically you have a protocol on your floor and you have to follow that. Okay, so for drips, you want to include what is infusing. So if it's anything significant, such as like dopamine or levo or anything like that, you can include it in this section here. I also like to include antibiotics if needed. Moving on to labs. So let's say, you know, the potassium was really low and was 2.5, and so the nurse repleted it with 20 MEQs of potassium, and then they rechecked it. Or let's say the patient has edema and they're given Lasix and it needs to be repleted as well. So that, you know, is definitely very important. You also want to include what the H&H is, so hemoglobin, hematocrit as well. And then what those trends are. You know, the nurse will also note if any blood products were transfused as well. And then moving on to like trough levels. So let's say the patient is on Tacro, you definitely want to make sure that you check the level, so that way you can know what the patient will be dosed at based on the doctor's recommendations. I also like to include on this section for micro. So with micro, I like to know when the last blood culture was sent, because that tells me that, you know, if the patient were to spike a fever, or if there's any signs or symptoms of sepsis, then I would know how to, you know, escalate the care based on the blood cultures, or what I need to do based on my protocol, or how I'm going to approach it. With that, I will include a sepsis. So I'm always doing on handoff a sepsis screen, which will be a separate video. However, I will include that and make sure if they are, you know, sepsis positive, if the team has been addressed and they're notified. I also like to include here is family. So family is very important. I like to include the DPOA. So who's the main person that I'm going to be contacting if I need to give updates. So I like to include their name, I like to include their phone number, and I like to always include the family. They are very, very essential. So on the corner, I always leave this little section open for me to where it's like to do. And I leave that open because if I'm talking to the nurse and she's like, oh, you know what? I totally forgot. You're gonna have to resend a PTT. So I'm gonna put PTT here and be like, okay, you got it. No worries. So then I'll put that in. So that's a reminder for me that that is something that I need to address and get done. Or maybe they have an MRI of the brain that's pending, or maybe they need an echo done and I need to call the doctor because he hasn't ordered it and I need to remind him, or for whatever reason. I like to keep this section open. So after I got report, you know, I definitely do that bedside. I like to do it at the bedside, and I like to actually do what's pertinent to the patient. So say maybe they are a neuro patient, so I want to do a neuro screen at the bedside, or maybe, you know, they have these really bad wounds that need to be evaluated. So I want to make sure that I take a look at that, or they have some type of drain. So I want to make sure that those drains are in place and where they belong. Or if they have a chest tube, I want to make sure that it is to suction, is actually working and it's patent and there's, you know, no air leaks or anything like that. So after that is done, when I have met the patient and I'm good and I, you know, say bye to the nurse, I like to get my piece of paper and I will fold it like this. And so I'm a morning person, so I do morning shifts. So I'll start off with time. So I'll put 8, and then I'll put 10 o'clock, 12 o'clock, 1400, 1600, 1800. So then I start to look through my med list and I'll write down, okay, so he has, you know, some aspirin due at this time, maybe some mid-toe with protonics. Okay, so and then I have to do an AccuCheck, so I'm gonna include that here. So I make a little check mark, so I need to check the AccuCheck there. And, you know, let's say it's AC and HS, so before and after each meal. So I'm gonna check it at 8 o'clock, I'm gonna check it again at 12 o'clock, and I'm gonna check it again, you know, before the end of my shift. So maybe it's 1700, so I'll put it in the middle here, so I'll put AccuCheck. And then I include everything. Maybe they have a scheduled, you know, MRI scan, so that's gonna be for the morning. But I want to be that nurse that's, you know, organized. So I'm going to call ahead. So I'm going to say call radiology or call MRI just to confirm and plan it, you know, with the team. Or let's say this patient is intubated, so I need to, and I know he needs an MRI, so I need to coordinate that with the respiratory therapist and make sure that we are organized and we know what's going on. And I will also notify the charge nurse as well. So these are the steps that I take in order for me to be organized. And I always I get report from the nurse. I'm always very, open, and if there's something that hasn't been done, you know, it's an ongoing shift, you know, there's things that it's busy, and I get it. So I always like to try and help out and do the best that I can. And so I will fold this piece of paper. So this is like my best friend. And then you can also, if needed, you can fold it this way and kind of just put it in your pocket. And then you're good to go. And then if you need it, you kind of just pull it out and you take a look at it and you're like, okay, 8 o'clock, I'm gonna do this. 12 o'clock, I'm doing that. 1600 this. And not to forget, you always want to include that CHG bath. So if they are a day or a nighttime, so let's say they're AM, so I'll be getting that done as well. Hygiene is very important as well. Hope this helps, and you know, this will be very, very helpful for you moving forward, especially for the new grad nurse or even for the bedside nurse that kind of needs a little review.
Thank you so much for watching. Make sure, thank you so much for watching. Make sure, what? Thank you for watching.